continue on to Frank Zanow. Studied electrical engineering in 87 to 92 at Germany, and then a PhD in Netherlands, low temperature physics, and concerned with bioelectromagnetism. Frank is also the CEO of Neuromotion. From my understanding, it's a parent company of Ant Neuro. Am I correct? EEG, Imagine, if I saw it correctly. So I'm really interested to hear about the future of mobile EEG and pervasive neurotech.
Thank you very much, Asaf. Can you hear me?
Yeah, quite well.
Very good. So let's share my screen. You can see my screen, I guess.
Yes, yeah.
Wonderful. So, here we go. Yeah, greetings from Berlin. And yeah, let me spend 15 minutes on talking about some aspects of the work we are doing here at Neuromotion, the group of companies that I'm heading. When I started my career as a business person in '97, I was just finishing my PhD. Had a position at the Max Planck Institute in Cognitive Sciences in Leipzig. I had no clue what the journey would be about. And now 2 decades later, yeah, I can tell you it has been quite a trip. And we've been able to create a very colorful line of products in the range of neuroscience and clinical care. And yeah, I share some of that journey with you. A very short, very brief overview of the company. We understand ourselves as a manufacturer and distributor of devices, solutions, and services for the study of human brain function. The whole thing started in '97 as a spin-off from the University of Twente in Holland, Enschede. And we nowadays have offices here in Berlin, in Germany, in Holland, in the US, UK, and in Hong Kong. All our products are branded under the label of Ant Neuro. That's how our users know us. And the products are designed here in Berlin by the company Imagine Medical Imaging Solutions GmbH, which is a subsidiary of Neuromotion. And yeah, this company here in Berlin, which by far has the majority of staff in our company, is a medical manufacturer with a lot of regulatory experience, also very innovation driven. And we also provide design and manufacturing solutions and services to third parties. Good to know. So let me start with the power horse in the company, the product that we generate most projects with and revenues with, that is zero compromise EEG. Our EEG technology and equipment got the name Ego, EEG to go, was launched some 7-8 years ago for the first time. We focus on small designs, but powerful designs that allow you to do mobile EEG without sacrificing in quality of your signals, without the need to buy a second stationary system. So the system you buy should be good for everything you have in mind in terms of mobile and stationary EEG. So we try to leave no wishes open. That's a challenge. It's a very competitive market, and you have to be good. You never can be satisfied with what you get. And yeah, based on that, I will continue very soon, but I cannot bring this presentation without making reference to some other products we have. We are very, very proud to have released recently a neonatal brain care product, a neonatal EEG monitor. It's a product that goes into intensive care units. A very different market, I can tell you, very challenging, also hungry for new features in terms of signal detection and prediction. So Neo tries to simplify neonatal care, and I would like to make reference to a center in Helsinki and discussions with Samsa van Hatteren, who has been a boundless source of wisdom and advice for me in the very early days of this project. We also provide solutions in the area of TMS. We take care of neuro navigation, MRI guidance, speech mapping solutions, robotic arm TMS, etc. That's an area we also feel very competent in and are successful in business-wise, but today's focus is somewhere else. I would like to have your attention on the topic of dry electrode EEG in clinical routine. This in itself is a contradiction. Yeah, clinical routine is a very conservative market, has been living with copper electrodes and paste for a long time. it is a hard sell to go into this market with dry electrodes. And we've been trying this for a while. So what is our approach here? Dry electrodes in this domain. Well, it starts with the electrode itself, obviously. We spent a decade in collaborative R&D with several academic and university partners across Europe. We have spent roughly €4.5 million between 2005 and 2016. That's when we released the first product. The first caps we delivered contain these flexible multi-pin dry contacts. So we talk about a flexible electrode, those things you see here in the fabric inside to the right. We work with a durable silver chloride coating, so expect good signal quality and low noise. We were aiming from the beginning on high density layouts. We use equidistant layouts for various reasons. It is amazing to see EEG popping up on the screen instantaneously when you apply the cap. That's really fascinating. Now, why so many channels? That's the first question you get back from a clinician. In clinical neurophysiology, people are used to working with 21 or 24, max 32 channels. And well, my story is we transform high density dry electrode input into high quality 1020 EEG output. And we do so by using high performance artifact correction, spatial transforms, and 3D source modeling. So this has been a very successful approach. The input, the raw data, the stuff under the hood works on 64 channels. What you see on the screen is 21 channels. And yeah, this is an ongoing project. There's still room for improvements, but there's an ongoing large validation study here with 10 systems right now in the field at Charité, which is not far away from here. So with this, I would like to move on to where we have been successful over the last 6-7 years, and that was mobile EEG in various disciplines in science, sports science to name the first. So in sports, there is so much to explore. I mentioned a few topics here: mental fatigue effects, performance under stress, and flow states in athletes. We have seen such a great variety of studies making a good use of mobile EEG. It all started in 2013 in a lab, in a CNRS research lab in movement science in Marseille. And what we've done at that time with gel-based high-density EEG, now today we can do with dry electrode caps, and that's really nice and makes life so much easier for sports scientists. And here just a impression and an illustration of how much fun it can be to work in sports science and to work with these scientists. So we have been through quite a number of disciplines in sports to primarily improve performance, but not always. So it's really about flow states, cooperation and competition in teams. It's really an endless list of topics that can be studied and will be studied. We also have some experience in consumer studies. Here is a very beautiful study that was done last year, and which shows that riding a motorcycle, as you can read, helps you to decrease stress and increase focus. I was not surprised to see this result, but it was big fun to work with these as a partner, and yeah, it's good for publicity, certainly. I would like to mention that we have moved forward in the past 4 years after the first release of dry electrode caps. We are now moving towards, or actually we are into this phase now, having 256 channel systems equipped with dry electrode EEG caps. You may wonder, what is this good for? Now, we are preparing for large-scale data collection projects. We have heard of AI projects before, but I made a note of Sensei, and I would like to talk to Dino about how to combine high-density dry electrode EEG with AI to have more subtle decision-making coming out of that. The requirements are tough. We want no compromise in signal recording quality. We want quick setups, so quick in every aspect. So the system must be simple to use. It must be out of the box. We want caps that work and data collection that does not rely on local storage, obviously. The whole system must be ready for self-application, because I do believe the EEG lab of the future is the home. So the conditions at home are tougher than in a Faraday cage in some neuroscience lab. And I would like to spend a few minutes sharing with you that there was a wonderful expedition last year that was exploring the effects of a psychoactive substance intake on brain and mental states. And now you can read yourself, but yeah, this was a demanding study. It brought us to the Peruvian and Brazilian Amazon, and it was a very interesting showcase for me to prove that extreme conditions are no limitation for us to record excellent EEGs. So just to give you a few impressions of that expedition, the whole initiative was taken by the National Institute of Mental Health in Prague in Czech Republic. Thomas Palenicek is the principal investigator here to the left, right next to the cameraman. And we are preparing for the first recordings in Santa Rosa do Purus. That's pretty much in the middle of nowhere. And we are undergoing several sessions of psychedelic substance intake, HP and ayahuasca. And we recorded fantastic data. As you can imagine, there's no electrical disturbance in these fields. You see a happy researcher here with a headlamp. And on that basis, I would like to invite all of you to share with me what might be your next interesting project in any of these domains in NeuroTech. We have quite some experience in some of these. We do not have much experience in, say, gaming and BCI, VR EEG. We are aware of many of those projects. We supply equipment but have no active collaborations. So my invitation is to you to talk to me, and let's see how we can join forces to make things happen. Thank you very much.
Okay, Frank, thank you so much for the talk. It was really fascinating. I think I will have a good excuse now to get my motorcycle driver's license.
Lovely.
A very good reason to do that. I did want to ask just a quick question. What is your thoughts on using your dry electrode technology for consumer products, not only for the clinical or research grade?
Look, the electrodes are available for use in third-party products. We have had various discussions with startup companies, as you can imagine, that want to be active in this domain. The electrodes, together with the amplifier, determine how good the quality will be eventually. So I would hesitate to say these electrodes can go in any given device. We see that the combination with the electronics really makes a difference. I'm very, very open to discussing this with whoever wants to jump on it. We have tested our electrodes to death, not only in electrical performance, but also in performance in sweat solutions, very aggressive chemicals, disinfection solutions. We've tested biocompatibility. We went through CE marking and FDA approval. So this has undergone already quite something, and also usability testing, not to forget. Yeah. We are now into the second generation of these electrodes with less hardness, so they are much softer than they were in the original phase. Mm-hmm. So I'd say yes, but it has to be seen in the context of the final device.
Of course. Yeah, I had the privilege of wearing quite a lot of dry electrodes for continuous hours, and I would say having them become softer is quite a big benefit. So yes. Thanks for that.